is the Emergency Medical Minute.
So Medical Minute today is about putting people to sleep. Go the hell to sleep, right? I was listening to that the other day, me and my wife, because we have a little one, and we laugh at that book. But anyways, what's the quickest drug to put someone to sleep or chemically sedate them if they're kind of agitated and you really need to protect, one, the patient, and then two, the rest of the staff because they just go on loony? Which one? Versed, great. Yeah, so there's actually a study that looked at Versed versus Haldol versus Olanzapine. And Haldol looked at two doses. And the question was, like, all of these were IM. Which one was the quickest one to put them to sleep? Versed won. And they said is when you give it IM after 15 minutes, is the patient where you need them to be? Are they like calm? They're not going to be fighting anyone, etc. And Versed won out. Around 89% of people with one shot of 5 milligram IM Versed were calm enough that you can do what you need to do as medical providers. After that, did you know what went out after Versed? It was actually Olanzapine. So Ziprasidone is better than Haldol when it comes to putting people to sleep fast. So 10 of IM Olanzapine is better than 10 of IM Haldol in terms of time of onset. Let's talk about one that didn't study was actually ketamine. And ketamine is one that we all use really quickly. If you actually have an IV, ketamine is the fastest. Giving someone, basically the dissociative doses of ketamine is by far faster than even giving them 5 of Versed IV. There's different things, too, that you have to realize with each one of these drugs about people you shouldn't use them in. So, for example, for Olanzapine, who's that bad in? It's mostly because it has a lot of anticholinergic effects. It's actually bad in old people. So if you have someone with dementia who's agitated, Olanzapine is not a great drug for them because it's going to worsen delirium because of the anticholinergic properties. Okay? For ketamine, there's a slight kind of risk that if you give someone ketamine and they actually have, let's say, schizophrenia, that for the next 90 minutes, once they start coming out, you'll actually worsen their schizophrenia symptoms. But that's pretty transient. That goes away pretty quickly. Also, really bad in old people who might have heart disease because it causes a lot of sympathetic surge. Ketamine does in those doses. Haldol. We love Haldol, right? At least I do, for a lot of types of different pain. The one kind of contraindication with Haldol is if there are a lot of other QT prolongers. In this study, which they did in Minnesota, they actually sedated 800 different people who are agitated with all these different medications. And one of the surprising things was the side effect profile between all of them really didn't change. The last cool thing about Olanzapine or Ziprasidone, when I was reading about it, can you give Ziprasidone IM or IV? Can you give it IV by chance? I see a lot of yeses and I see a lot of nos. So on the FDA, you cannot give it IV. But there's several studies that say it's absolutely safe. And that's the same as Haldol. Haldol is not approved for IV, but we give it all the time. So the same thing applies to Ziprasidone. Ziprasidone is very safe if given IV. And apparently there's a new study that came out in the New England Medical Journal. Like I said, for some reason I just sit in bed and read this stuff. That actually says that this is really good for chemotherapy-related nausea and vomiting, because not only does it block dopamine receptors, it actually blocks serotonin receptors too, which is what Zofran does. Okay, thank you.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.